All right, our next speaker is Dr. David Kennedy, and honestly, his CV is too long to go through, so let's get some highlights. He's a past president of the Academy. He is a master in the Academy. He's done numerous films for us, Poison Horses, Crippling Waters, Fluoride Gate, excellent documentary. He's the author and the creator and the narrator of the Smoking Tooth video, which has like a bajillion views on YouTube. What else? All around good guy, and a master with fluoride. So, Dr. David Kennedy.
When I was writing my book back in the 90s and late 80s, I sent a chapter of my book off to my friend Rick Hudson, a physician in Orlando, passed away now. I sent my chapter on fluoride off to him, and he came back looking like he was bleeding to death with all the red marks that he put on it. And he said he thought I needed to rethink my position on fluoride. And he gave me a couple dozen references and told me to go read a book called Fluoride, the Aging Factor by John Yamianis. Yamianis' first edition. And the first edition was only about 180 pages. I could handle that. And I realized instantly that Dr. Yamianis knew a lot more about fluoride than I did. And but his later edition was like 350 pages, which convinced me even further that there's a lot to the science of fluoride that they've kind of glossed over in our education. The reason that the dental profession is confused about fluoride is because we've been lied to. We've been deceived. And it's not accidental, it's intentional. Fluoride is the 13th most abundant mineral on the planet. It's impossible to be deficient in fluoride. I've had patients that other dentists that say, oh, they said I had a cavity because I was deficient in fluoride. Well, to be deficient in something means it has to be an essential nutrient. And if you go look at the Federal Register in 1979, the FDA said remove all reference to fluoride as a nutrient or probable nutrient. And that's because when they gave the rats progressively less and less and less and less and less fluoride, the better the rats did. So it's the opposite of a nutrient. It's what's called a xenobiotic. And I've been arguing about this for 25 years. And one gets really tired of what Boyd Haley calls the 7-year argument with the town drunk. And the mercury poison dentists can't track. They're not on the same page. And, oh, your funny looking spotted teeth, it's just cosmetic. So I took my key and ripped it down the fender of the BMW, and I said, no, it's just cosmetic. So these are idiotic arguments. So what happened, the best new thing in 2016 was the FDA had an armed delivery man bring this into David Humphrey's office and serve him with a notice. It's called an FDA warning letter. David Humphreys is the chief executive officer and president of Kirkman Laboratories. It's almost like the Costco house brand Kirkland, but this is Kirkman. And so if you want to find this, you can Google FDA warning letter Kirkman Laboratories, and up pops a PDF of what he was served with. Let's see what was so urgent that they would send somebody to his office in the early morning hours of the 13th of January. And it said, so I'll summarize what it says. It says, never, not area, never. And so, guys, what are they so upset about? And what terrible thing were they doing? Is that Kirkman Laboratories was manufacturing and selling prescription fluoride. And they said that they are not to ever manufacture, sell, or distribute this product again, because it's not FDA approved. So when you hear, oh, it's not a drug, it's a natural mineral supplement, and that's not true. It's a drug, according to who determines what are drugs? That would be the FDA. And so it's a drug that's not FDA approved, and that it has. There was a congressional investigation in 2000 that where they asked the FDA is that what fluoride-containing substance intended to be ingested has been approved by the FDA. And I guess the first question was, is it a drug? And what they said was any substance used to treat man or animal is a drug regulated by the FDA. The follow-up question was what fluoride-containing product intended to be ingested has been approved by the FDA? And they replied none. And that there are no new drug applications on file. And then they lied, and they said none have been submitted. Actually, there have been 36 applications submitted, but, corporate memory, collective memory, they probably didn't remember that in 1975, 41 years earlier, they allowed all 35 applications to be voluntarily withdrawn and one to be rejected. So they rejected one application. So when somebody says, oh, I'm prescribing fluoride for your child, that remember they're prescribing an unapproved drug, which is a felony, and you'll lose your license for that. So the congressional investigation determined that it is a drug, it is not FDA approved, and that means it hasn't been proven safe. So when the dentists walk around with their mantra, safe and effective, safe and effective, safe and effective, every time their lips move, they're making it a drug. And what they're advocating is that the population consume an unapproved drug. And that the levels that have been approved for use in toothpaste and mouthwash are 1,000 is the lowest level in toothpaste. Crest is like 1,000 parts per million. They've been trying to get a lower level approved, and that they submitted 500 parts per million toothpaste. And the FDA rejected it, said that the evidence did not support use of a lower level. There was no evidence of effectiveness. So when they say, the water at 1 part per million is so toxic that it splashes against the teeth and the poor little germs get sick. That's not true. You can't make the germs sick with less than 500 parts per million. Or 1,000 actually, because the 500 was rejected, right? So the other thing that they pointed out in this letter is that you have to look at the URL, they give you a reference, and it goes to the FDA nutritional determination. They said never without a prescription, and never in children under the age of 3. So when you put this product, in my book, I detailed the death of a 3-year-old child who was in the dental chair for his first dental visit. And the hygienist was talking to the assistant about her new nail job and yada, yada, yada. And she put a topical fluoride in the child's mouth and then handed him a little glass of water. And what does a 3-year-old do when you hand him a glass of water to drink? And then he took him back to mom, who was in the waiting room, and the kid threw up. He said, what did you do to my kid? We didn't think the kid got the flu. And she argued with him about how he was perfectly healthy when he went to the office, and now he was not. And they said, well, you need to take him downstairs to the doctor downstairs, because we didn't do anything to your child. And so that's summarized in politics as deny, deny, deny. And so she went downstairs, and, busy doctor, waiting room, and all that. And the dentists like to say, well, yeah, there is a toxic level of fluoride in the topical treatment that we do in the dental office. But if you get too much, you'll just throw up. Well, this child had thrown up. And so she waited in the waiting room long enough for the doctor to see her, which was probably about an hour later. And when he put his stethoscope to the child's chest, he heard about 20 beats a minute. The child was going into cardiac arrest. Do you know why you die of fluoride poisoning from a bolus dose like that? Cardiac arrest. And because it sucks all the calcium transport out of the heart, so the heart quits beating. So he injected the heart with a big glob of adrenaline called 911, and they transported him to the hospital, and he perished while they were trying to pump the stuff out of his stomach. They recovered enough fluoride from the child's stomach to kill 3 children. And during their malpractice trial, both the dentist and the dental hygienist testified they had not realized that fluoride was a poison. Do you think maybe we may have glossed over something in our education? Look at the informed consent. Dear Mrs. Jones, I know this is your child's first visit to the office, but in this office, we're very concerned about tooth decay. And so what we're going to do is we're going to paint your child's mouth with a deadly poison. And we're going to be very careful to make sure that your child doesn't swallow it, because if they do, they will die. And we can't treat that because, death from fluoride is a medical problem rather than a dental problem. But we'll be very careful not to let him swallow. Please sign here. Do you think any mother that liked her child would sign that? Probably someone would sign it. My mom would probably sign it. Get rid of that kid. Come on, let's go to the next one. Maybe this will work. There we are. It's an unapproved drug violation. There are no FDA-approved applications on file. So if you're a pharmacist, and I'm telling you, we can end this argument right now. We do not have to have another 15, 20 years of arguing. And if every person in this room would get a copy of this letter and go to their CVS pharmacy, Savon, Walgreens, and ask the pharmacist, do you have any unapproved drugs for sale here? Oh, no. They'll quake in their boots because that would be cause for them to lose their license. We don't carry any unapproved drugs. Well, then you probably don't have any fluoride vitamins. Oh, yes, we have those. Or fluoride tablets. Well, yes, we have those. Perhaps you should read this letter. Because at this present time, this letter has not gone to every pharmaceutical company in the United States. It hasn't gone to every pharmacist in the United States. And that's my goal, is to make sure that this letter is in the hand of every distributor of fluoride vitamins and tablets in the United States, so that they can no longer deny, like the dentist and the dental hygienist, that they didn't realize, I didn't know. Why is that going to work? I mean, if you crunched over somebody with your car, and the judge was saying, you crunched over that fellow with your car, I didn't know what that lump was. That doesn't generally get people out of trouble. But the dentists think that if they don't know, ignorance is bliss. But if we put this in the hand of every dentist and pediatrician and pedodontist in the United States and say, are you suggesting that your patients take unapproved drugs? They'll say, they didn't cover that in my dental education. They didn't cover a lot in their dental education. The marketing of these drugs or other new drugs without approved applications constitute a violation of the Food and Drug Act of 1938. So the dentist, like say, is grandfathered in. Well, to be grandfathered in, it had to be in use prior to 1938. Well, the only thing fluoride was used for before 1960 was the 1960s when it appeared in toothpaste. The only thing it's used before was to kill stuff. It kills coyotes, rats. It's widely used as a pesticide. If you want to get a high level of fluoride in your wine, drink an ordinary wine. Because when those planes with the two wings fly over them, they're spraying sodium aluminum fluoride, cryolide. Very effective, even at 1 part per million in killing bugs. So, misbranded violation. You're responsible for investigating and determining the cause of the violation identified above to prevent the recurrence of other violations and the occurrence of other violations. They're not done with this guy. But that's exactly what the highway patrol does. You all know that we speed. The speed limit's 65 and you're going 70. And periodically the highway patrol will turn on the blue and red lights and pull somebody over, and they make them walk up and down side the road and touch their nose and put their hands on the hood and all that stuff. All of us let off the gas and kind of slow down for a few minutes and look in the rearview mirror and make sure there's no black and whites behind us. Now the turkeys are driving white cars. The FDA doesn't attack everybody. They attack one. and then they take their life and macerate it. This guy's going to be in court for years. They're going to tear him apart, limb for limb, piece by piece. So my new commercial that I'm going to put on YouTube is, has your dentist prescribed fluoride vitamins and tablets for your child? Does your child have funny looking spotted teeth? Is having trouble in school? Call the law firm of Boyd, Dewey, Cheatham and Howe, and we'll give you a free dental examination to determine if your child was injured by the dentist giving you an unapproved drug. So, the purpose of that is not really to facilitate the growth of the law firm of Boyd, Dewey, Cheatham and Howe, but to put a little pucker factor in the dentists that are still saying, I prescribe fluoride for my own children. I was talking in Nebraska at a city council meeting, and it was the best forum we've ever had. We had the idiot Michael Weasley over here, me over here, who was a guy who has no kidneys, and the mayor was in the middle, so I could grab a hold of the bottom of his coat and give a tug. And so the dentist, in their usual effort to promote water fluoridation, had packed the room with people from various towns within about 100 miles. They said it's their moral obligation to come and promote water fluoridation in Norfolk, Nebraska. And a dental hygienist came up to the microphone and she said, well, I know that fluoride is very good for tooth decay, to prevent tooth decay, because I have 3 daughters and there's not a cavity in the whole family. Not one. And Michael Weasley says, well, that's just no example of how great fluoride is in preventing tooth decay. I'm tugging on the mayor's coattail. And when they got done, it came to my turn, and I said, do you have any neurological impairment in your daughters? And she turned white and disappeared. I don't know why I said that, but who came up to me after the meeting was her husband, who was a dentist. And he said, what do you mean about neurological impairment? And I said, you know, like learning disorders or movement disorders, and you kind of brain damage from that. And he said, well, she's got Downs. And I said, your oldest daughter? And he said, yeah. And your wife was 22? Yeah. And I said, that's an entirely different thing it does. It causes breakage of the DNA. And I reached in my briefcase and I pulled out the article by Robert Schatz, who basically did a study in Chile, where they had fluoridated some of the community and not fluoridated some others, and he went in and he measured the Down babies. And what he found was the incidence of Down syndrome is where you get your chromosomes don't go cross right, so you end up with a scrambled chromosome. And it usually occurs in an older mother, because the eggs are getting old, right? That's why you have the panic attack, when you're 38. The 20-year-olds in the fluoridated community were having scrambled DNA at the same rate as the old women, 40 and above, were having in the non-fluoridated community. So that's the title of John Yannis' book, Fluoride, the Aging Factor. So it accelerates aging. And so I sent him a copy of the thing. I don't think it's going to make him feel any better about it, but he gave his wife fluoride tablets because they lived in a non-fluoridated community. Oh, so he gave his wife an unapproved drug. And there are reasons why we don't approve things. Is you got to show that they're safe first. And that what the FDA said in 1975, when they rejected the application for insatiable, when you hear fluoride, there's fluoride in it. And so Prozac, fluoroxetine, Cipro, fluoroquinone, fenfluramine, the one that eats the heart, fluoride-containing compounds. It's in lots of drugs. But they said, because there's no substantial evidence of drug effectiveness as prescribed, suggested, or recommended in its labeling. Say, that doesn't sound like a glowing recommendation from the regulatory agency, does it? It took 41 years to do the next thing, which is tell the manufacturers to quit selling it. You really shouldn't have to tell them that, do you think? So water fluoridation has been going on based upon the recommendation. You know the difference between science and recommendation? Well, Socrates used to teach his students how to tell the difference between truth. He said truth comes from God and it's immutable. It never, ever changes. And opinions are where evil comes into society. And that opinions, he taught his students to recognize things that change like the weather vane on top of the church, or they change like the wind. And so the opinion about fluoride keeps changing. And so one of the things that came out in the EPA in the beginning was that they started out at 1 part per million because the data said that, in their opinion, was a good level. And then they changed that to 1.2 in Alaska because those people don't drink much water because it's hard and they can actually melt it first. And then the people in Florida that drink a lot of it because it's liquid is 0.7. And what they did a few years ago is they, since 41% of the children nationwide had dental fluorosis, they changed their optimum level to 0.7. They didn't change anything. They just quit recommending the 1.2. And why would they do that? Is because the National Research Council, in March of 2006, after a 3-year review, and remember, the head of the committee is Duell. Duell is the person that kept coming up with all these studies through the 60s, 70s, and 80s, showing that smoking was good for you. He's the smoking guy. He's the go-to guy for DS. No, nobody believes that anymore. But they knew he was the kind of guy they could rely upon to bring this committee in. And they included in the committee Kumar, who's now the director of dentistry in California, who loves fluoride. And they had 3 people who didn't love fluoride. Hardy Langback, Bob Isaacson, and Kathleen Thiessen. Those 3 scientists were able to flip the entire committee to vote unanimously to reject the EPA MCLG. MCLG is the level of any substance in your drinking water that you can consume for a lifetime with no adverse health effects. Maximum contaminant level goals, what MCLG stands for. So the MCLG for a lifetime of exposure today, 10 years later, is still the one that this committee was asked to evaluate, and they said unanimously it was not a safe level. And then they went on to list what kind of things happened. So among other things that happened at the supposedly safe level that the ADA argued for, actually the ADA argued for a level that was twice as high. But they said hip fracture, bone pathology, kidney damage, and if you have bad kidneys, it damages you more rapidly because you don't excrete it. There's evidence of neurotoxicity. That's Bob Isaacson's work. Dr. Isaacson is a world-class neurologist. And what horrible level of fluoride did they expose these rats to find the neurological impairment? They made them drink 1 part per million pure pharmaceutical-grade sodium fluoride and 1 part per million pure aluminum fluoride. Both the sodium fluoride rats and the aluminum fluoride rats doubled the amount of aluminum in their brains. And they had lesions visible in their brain, arteries, and kidneys from 1 part per million. And let me help you understand. A rat is not a good animal to test fluoride on, because every person in this room would die if you gave them 5 milligrams per kilogram. But if you all were rats, if we gave you 100 milligrams per kilogram, only half of you would die. So when you give the alleged optimum dose to rats and they have holes in their brain, arteries, and kidneys, it's probable the children that receive 1 part per million have a similar problem. Endocrine dysfunction means your thyroid gets damaged. And there's a really good chapter in the book, and I'll get to that in a second. And the evidence of carcinogenicity is covered in some detail in my film, Fluoride Gate. You can watch it online, you can buy DVDs and throw them out like presents to your patients. And you should have it playing more or less continuously in your waiting room, except it would drive your receptionist crazy. The Fluoride Gate was all about the shenanigans that have been going on for years and years and years to keep you and the American public in the dark. And the National Toxicological Program was ordered by Congress in 1970. The Fountain Committee reviewed fluoride. It appeared that there was an increase in cancer death rates when they added fluoride to the water supplies of 10 cities in the United States compared to 10 control cities. So Congress ordered that this be studied by the National Toxicological Program. They didn't quite get it done on time, because it should have been done in 1978, 79, 80, 81, 82, 83, 84, 85. They got it done in 1989. So it took them 10 years to do a 2-year study, and the high-dose animals were washed with disease. They had cancer of their lip, tongue, throat, liver, and bone. That was until the very people that have been promoting fluoridation in this country for the last 60 years took that study and they re-examined it, which means changed every single cancer finding, not one level, but 2. So carcinoma in situ on the lip became dysplasias. The bone cancer they couldn't get rid of, so they threw out the biggest bone cancer and they said, well, that has to be an anomaly because the cancer that big would have killed the rat. So we're just going to ignore that one. And what they said with the other was that the bone cancer was exactly where you'd expect it to be. It is that fluoride accumulates in the bone. And what happens is, when the bones are growing, there's high turnover in the bone, right at the point where it's growing. And that's exactly where little boys develop tumors. It usually kills them. If it doesn't, they lose the limb. The whistle was blown by Bill Marcus, and the EPA fired him. Who was Bill Marcus? Chief Scientific Advisor at the Office of Drinking Water. He was the head honcho. And he pointed out what they tried to do was they said, well, rats get cancer anyway. So what we need is we need to have the controls within the study controls had fluoride-free food and fluoride-free water. And so they went to other studies that had nothing to do with fluoride and took the controls out of that and said, well, this is our historical controls. It has 6,000 animals in it, so their cancer rate is here, so that will be our zero cancer rate, right? So they raised the playing field, so now it looks like these animals should have cancers. And what Dr. Marcus did, he said the way we determine whether something's a carcinogen is we look at the lowest dose, and we put a pin in the line, and we look at the medium dose, and put a pin in the line, we look at the high dose, and put a pin in the line, and if we get a nice straight line graph, then we know that the cancer reduction is linear. And so he took the historical controls and determined that these animals were actually a medium dose animal. How did he figure that out? He measured their bone ash. The way you figure out lifelong exposure to poisons like lead and fluoride and so forth is you measure where it accumulates. Fluoride accumulates in the bones. So when you ash the bone, you can basically come up with a measure of what those animals were exposed to through a lifetime. And the lowest dose animals had the lowest level in their bone. The historical controls fell into a medium dose, and the high dose animals came to the high dose, and it fit perfectly on his predictive line. Is that the high dose had the most, low dose had the least. So if you want to have less cancer, eat less fluoride. And so when we talk about neurotoxicity, it's not a big surprise that it is neurotoxic because fluoride is more toxic than lead and only slightly less toxic than arsenic. So it's predictable that there's going to be brain damage from exposing children to this, and especially children, but adults as well. If you want to see some real crazy people, one of my psychiatrist friends, they used to do a way you can tell your current exposure to fluoride. Fluoride is excreted through the kidneys if you have normally functioning kidneys. So you can do a 24-hour urine sample and measure the amount of fluoride in the urine, and you've got a pretty good estimate about double that number, and you had how many milligrams of fluoride a day that person had eaten. And so he had a psychiatrist, had lots of patients on Prozac, and almost all of the psychoactive drugs are fluoride-containing drugs. Rohypnol, the gateway drug, is a fluoridated drug. And so we basically measured the amount of fluoride coming out of people. And what he showed was that the ones that were doing the worst were the ones that had the highest urinary fluoride level. So he decided to go with another way for treating psychiatric disorders like IV vitamin C. So the Lancet, 2014, Granchine writes that fluoride should be classified as a neurotoxin just like mercury and lead. So be sure to inform your patients if you're going to continue to use the fluoride-releasing sealants or the fluoride-releasing fillings, and that we don't know how much fluoride is going to contact the cheek or the tongue that may come in contact with these sealants or fillings. But we know that the rats that had 79 parts per million fluoride got cancer of their tongue, lip, and throat. Everywhere the 79 part per million fluoride water hit. So when they put 1,500 parts per million in the sealants, you might question, or 50,000, I guess, is the sealant level. Griffin Cole was the humble little guy that was here a minute ago introducing me. He was so nice, but he decided to get on their case about the fluoride sealants. And so he humbly wrote to the sealant manufacturers and said, say, where's the FDA approval for those fluoride-releasing sealants? And they sent him the information for coprolite. Not one word about fluoride. Coprolite, isn't that the crap you're supposed to put in the bottom of an amalgam filling to keep the tooth from turning gray, and it doesn't work? Yeah. So they repositioned that, now that people are doing this and decided to add fluoride to it, and had every school nurse from Kansas to Arkansas paint all the little children's teeth with that so that they got a huge dose of fluoride from the school nurse. Wow. So we got the school nurse applying unapproved drugs. Untested chemicals should not be presumed to be safe to brain development, and chemicals in existing use and new chemicals must therefore be tested for neurotoxicity. I think that's a very good idea. You won't get an agreement from the people manufacturing those untested chemicals, however. So the side effects that the NRC pointed out, if you don't know who NRC is, that's the scientific arm of Congress. I know that's an oxymoron. But they were empowered to determine answers to tough questions. And so, but enamel fluorosis is one of the effects, and it's really good for business because one of the growth industries in dentistry are the porcelain laminates that we slap over these funny looking spots. And so the fact that water fluoridation causes dental fluorosis, I've had dentists in community meetings in Texarkana, Arkansas. The dentist said, I've been a dentist here for now 18 years, and I ain't never ever seen a case of dental fluorosis. Well, if you use their method of measuring dental fluorosis, which means that if you have 2 teeth that are damaged, you get to be counted. If you only got 1 tooth that's damaged, you don't get to be counted. So that's kind of how I treat that BMW. I go out there with a hammer, and I just smash out one headlight. I'm a dentist. We don't count the first a damaged tooth. I'd have to hit both headlights before we could count it. And then only half the tooth, we call it very mild. And it's moderate if it's more than that, when the whole tooth is damaged. We don't call it severe until parts of it are missing. So if I took the door off, it would be severe. So this is a study that was done in 1987. But if you can read with your good eyesight, you can see it says 1997. And that's because in 1987, they did the study, and then John Yamiana sued him for the data because the NIDR was saying, oh, water fluoridation is really good for everybody. It was wonderful, it was really good. There's no problem at all, yada, 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 yada. And he said, I'd like to see the data. And they said, no. He took it to the court, and the court says, we don't have secret studies. Of course you can have the data. And so he asked for the dental fluorosis data and the tooth decay data, and they committed a crime. They perjured themselves in court, and they said they had lost the dental fluorosis data. Well, let me ask you this. If I was working for you, and you paid me $11 million to do a study, and I came back and I said, I lost it. The computer crashed and all the data went bye-bye. I'm sorry about that. You think I'd keep my job? Well, they kept their job because they hadn't really lost the data at all. They were just perjuring themselves before the court. And the Heller eventually took the data and using the 2 teeth damage before we count any of them, showed that in areas of the United States that had 0.3 or less fluoride in the water, that 14% of the children had dental fluorosis. And if it went up to 0.7, that it was about 25%, 26%. And if they had the optimum level or above, that it was up to about 32%. And that if it's above that, it went up to 40%. And so this is the kind of graph I kind of like to see. It looks kind of linear, doesn't it? And that's what it is. It's linear. And so the dental fluorosis data produced by the advocates for fluoride in our drinking water established firmly that the more fluoride in the water, more damage to the teeth. And they're claiming that fluoride was reducing tooth decay. If you look at the permanent tooth decay and look at the data that they collected, can you see the 60% reduction? What are the dentists saying now? Is it 60 or 70? It doesn't make any difference because they're making it up. They come to the city council and they pull some number out of where it's dark and smells bad and start touting it as being proven, safe and effective, and it's going to reduce tooth decay by billions of dollars. Do you see billions of dollars in differences? No, there's no statistically significant difference between the high fluoride areas, the medium fluoride areas, the low fluoride areas, and you know why? Fluoride's got nothing to do with tooth decay. It's a poison. It has only to do with making the little germs that are living on your teeth sick as a dog. And then they can't produce acid for about 20 to 30 minutes. And then when the fluoride washes off, they go back to producing acid. So that's why you're ripping the patients off if you're charging them for a topical fluoride treatment, because you're using a really high strength fluoride, 15,000 or more parts per million. And then 30 minutes later, their saliva has washed that away and they've swallowed it, and their tooth decay rate goes back to exactly what it was if they brushed with toothpaste. Good for our revenue, but I got lots of ways to make money, and one of them is not ripping people off. This young lady was raised in San Francisco, an area that had silicate fluoride to the water supply. And that you notice that there's 2 different colors in her teeth, brown and white. And the dentists are surprised to learn that the color of the dental fluorosis is not part of the classification, because all teeth start out white, because this is an injury that occurred underneath the gum while the tooth was forming. Now let's think about that a minute. Is that this tooth was never in contact with drinking water or toothpaste. It was under the gum in contact with the child's blood. And it has a spot. We now know why the spots are on that teeth. Is because the enzyme, which is essential, teeth are basically a protein shape. It's a tooth bud, but it's basically like God says, I think I'll make a tooth, and I'm first going to make a clay model out of protein. And then I'm going to have a very special enzyme called MMP20 come in, and they're going to remove a molecule of protein and then put in a molecule of calcium hydroxyapatite. So it's a swap out. I've got clay here one moment, next minute I've got stainless steel, or I've got calcium hydroxyapatite for the protein. And the reason that spot is there is because the MMP20 enzyme was inhibited, and it didn't do its job. Well, it's really good that MMP20 only works on teeth, right? It's essential for neurological development and fetal development, growth and development of the child, and bone development. It's one of the most important enzymes in the human body. So when you see dental fluorosis, you know that our favorite intervention to allegedly prevent tooth decay has injured every organ in that child's body to to some degree. Did they fall over dead? That's the one, the dentist, I love them. They said, well, I haven't seen anybody die yet. I said, you haven't been by a graveyard, have you? They usually put little markers out there. then they come up with the bill claim, well, you can't prove that. So this is a lady that drank naturally fluoridated water from the rocks bouncing across the Rocky Mountains. And she's not happy with how her teeth look. And the dentist would say, oh, it's just cosmetic. And she says, yeah, it's really ugly too. And so this is from the National Research Council, and I do that just to check your eyesight. Can anybody see the disproportionate harm to Mexican Americans and Black Americans versus the white? Oh, okay, I'll make it like this. And what you can see is that the level of dental fluorosis occurs in higher levels in the African American and the Hispanic community, and that's what we call disproportionate harm. That makes it unethical. It's not ethical to harm children anyway, in my opinion. But now we're causing a disproportionate harm to people that must share our water supply with us. And disproportionate harm, depending on how much fluoride is in your water, is not an ethical thing. And so in Sweden, they had trouble getting the dentists to pay attention until they brought in an ethicist, a medical ethicist. Is it ethical to prescribe a treatment that causes injury to some but not others? And the medical ethicist, easy for you to say, managed to convince the dentist of Sweden that it was not appropriate professional behavior to recommend this kind of treatment. And they backed away from it about 30 years ago. And that's why none of Europe has fluoride in the water, with the exception of England, which is about 10%, and Ireland, which is 60%. Guess where the worst teeth are? Ireland. So, my recommendation is that you minimize your exposure to fluoride. And how would you do that? Well, you drink water that doesn't have fluoride in it. That's a good start. You avoid going to dentists that have fluoride-releasing fillings and cements and sealants. And when your doctor wants to prescribe Cipro, remember when the anthrax was in the envelopes and they decided that the postal workers had been exposed to potential life-threatening anthrax, and they put them all on Cipro? If you pull out the package insert for Cipro, it says for use for 1 week only. And that if you're going to use it for longer than that, consult with your physician. Well, they didn't consult with their physician, but if they'd asked them, why do you not want to use that for longer than that, it's what happened to the postal workers. They developed crippling arthritis from taking Cipro for a prolonged period of time. They forgot to tell you that one of the primary effects of fluoride exposure is joint pain, because your body fills up the bones with fluoride. When it can't park it in the bone, it starts making abnormal bone spurs. And the pathologist told me one time that you can tell instantly whether the animal or the human was exposed to fluoride at excess levels in their life just by taking the bone, the femur, and running your hand down. If it's a healthy bone, it's slicker than snot. If it's a fluoride bone, it feels like sand. And so why is pain one of the biggest characteristics of excess fluoride exposure, especially in the lower lumbar spine? We're not sure why it accumulates there, but it does. About 60 million Americans complain of arthritis and pain in the lower lumbar spine. And that's a lot higher than other nations that don't add fluoride to their water. The rough bones, muscles move on bones. They're slick, so the muscles can move back and forth and not be sanded by the bone. And so it actually forms abnormal bone outside the bony case. And that's where the pain is coming from. Dietary sources of fluoride, I love this IAOMT. They always serve iced tea. And I don't have my slides in here, but there was a lady in Independence, Missouri who developed crippling skeletal fluorosis because her favorite beverage was Lipton instant iced tea. Understand, instant means that you made the tea and you dehydrated it. And then you had a little tablespoon of this into the glass of fluoridated water from Independence, Missouri. And now you've got the local water with the fluoride, and you've got the concentrated fluoride in the instant. So anytime you see something that's instant, if it's in a box, powder that's been dehydrated, including baby formula, until 1979 when the FDA made them move the formula outside fluoridated communities, then you're going to have concentrated fluoride in your diet. And then the environment, most people don't realize it, but if you happen to live next to a cement factory, move. Because the kilns that manufacture cement drive fluoride off the limestone. And it comes out the chimney. Because as long as the dentists have everybody convinced that fluoride is wonderful, you won't get environmental controls of fluoride. And so it leaks out of stuff. 3 different courts, and I think this is a major problem in our country. 3 different courts have determined on a fundamental basis to give an injunction saying fluoride increased cancer death rates. That's different than causes cancer. I was talking about that earlier. It probably does cause cancer, but these courts determined it increased the number of people that die of cancer. That's different. That's cancer death rate. And that's what the study was done on by the Dean Burke, former head of the National Cancer Institute. And we can't do that study anymore because so much of this country has been fluoridated because there's $100 million a year being spent on lobbyists from the Center for Disease Control. All the dentists, you know, that go to dental school and they're really, really idiotic and they can't get a job and they're brutally ugly to their patients and so they basically go bankrupt. They can go get a job at the U.S. Public Health Service or the Center for Disease Control promoting fluoridation. Because there's a huge demand for liars to come out and tell the communities how good it is. Well, anyway, 3 different court cases, and Texas, Pennsylvania, and Indiana. And what they said was, it was a harmful substance, shouldn't be added to the water supply. All 3 were overturned at the Supreme Court level, in those states. And what they said was that a fair preponderance of evidence shows that the injection of fluoride in the city's water supply would be harmful, but held that such proof of harm was not enough to arrest and exercise of the police power. We have given our elected officials the power to poison us if they deem it necessary, as long as there was even one expert that they could rely upon. Like the dentist that couldn't satisfy his patient's needs or her patient's needs and got a job. If they'll come into court and say, that's a good claim too, they can rely upon that dentist. It's not the preponderance of evidence. It's one person. So, my favorite thing to do is to make movies. I retired from dentistry to make a change in our profession. I'm a 3rd generation dentist. I'm a 10th generation American. And if you don't stand up and fight for your country, industry will take it away from us. That's exactly what Dwight David Eisenhower told us. You have to protect the people from industry. And so that's what I'm trying to do. The dental industry is busy putting substances in our mouths, in our water, that will harm our nation. And if you sit back and say, well, you know, I think I'll just quit using it, but I'm going to remain silent because the dental society wouldn't like me, I would call you a coward. I know those are harsh words. But at one debate, I was informed that I'm the only dentist in the United States that doesn't like fluoride. Do you believe that? I don't believe that. But they were able to lie to the public. And that's all they do. And in London, the Telegraph reported that it may trigger depression, weight gain. We have the fattest nation on the planet. Is that related to the dental intervention with fluoride in the drinking water? We have one of the highest tooth decay rates on the planet. Well, if fluoride was so darn good, how come we have, for the developed nations, higher tooth decay than places like Denmark and Sweden that don't allow it in the water supply at all, and most of the toothpaste is forgiven? Last year, Public Health England released a report saying that fluoride was safe and effective way to improve oral health, but new research from the University of Kent says that there is a spike in the number of cases of underactive thyroid. Why would that be important? Because that's what fluoride does. In the 30s, if they wanted to kill your thyroid, they had you take a bath in fluoridated water. Anybody bathing? Fluoride is a strong electronegative chemical, and it rips an ion off of every single element in the periodic chart, including the inert gases. They're supposed to be inert, right? Fluoride will rip them apart. And it breaks hydrogen bonds. Hydrogen bonds are the Velcro that holds your DNA together. You can inhibit DNA repair enzyme 50% at 1 part per million. And the dentist like, oh, you never reach that level in the bone. The heck you don't. They've measured over 1,000 parts per million in the bone, especially where a tooth is erupting. You know, when you put fluoride in the water, you cause the teeth to come in later. What mother do you know that says, it's really good and that kid hasn't got his permanent teeth yet, he's really slow? Well, that's what his brain is going to be doing too, slow. It acts like G proteins. G proteins are the switches that turn genes off and turn genes on. Well, fluoride turns them all on. It'd be like having a 7-year-old run around and turn all the lights on all the time. Endocrine disruptor. How can this be? And it's because we've been lied to. And it's an intentional lie. And I'm here to tell you that you can spot the liars. You don't have to be a rocket scientist. You just have to pay attention and then go look and see what they're doing. What element in the periodic chart has an army of lawyers on its side? Oh, that would be fluoride. So Christopher Bison's book goes through it in some detail. If you want to read the book, that's a good thing to do. If you can't stand that, or maybe your concentration level's a little low, you can watch the YouTube video of it. 30 minutes. The Cochrane Review, which is now being denigrated by the dentist, they said, oh, we're going to get the Cochrane Review to decide that it's a good thing. And the Cochrane said that the available data from predominant studies prior to 1975, and they were unblinded, and that's what the courts rejected all of those studies because they're unblinded studies. Nobody's doing unblinded studies except the dentists. And R.N. Sutton wrote a book that went through the data, every single one of the studies. They didn't even have the number of people examined consistent for their various reports. And one study had one tooth in the study. This is their evidence. So if you insist the filter you want is broad-based and blinded, they don't have any studies showing a permanent tooth decay decline of a significant, statistically significant amount. So that means they're lying, right? So we're not putting fluoride in the water, and here's where the money comes from, is that they put hydrofluorosic acid, and this used to be generated within the United States as part of making nuclear weapons. Now we get it from China. Don't they have nuclear weapons too? Oh, we're helping them dispose of their fluoride because they don't allow it in the water in China. Japan, no, we get it from Japan. Mexico, yeah. Belgium, Holland. We're buying everybody's silicon fluoride from around the world and putting it in our water supply. Is it just silicon fluoride? Read the warning. It's got arsenic and lead and cadmium and mercury in it too. So you're basically recommending that we swallow stuff. And you heard about this study where they stopped putting fluoride in the water of Calgary and the tooth decay went up. Y'all heard that, didn't you? Where the cessation of fluoridation caused an increase in tooth decay? Well, it's a Canadian study. You know how those Canadians are. But stop that. They claim tooth decay dramatically increased in children after fluoride cessation in Calgary. And this lady, McLaren, the study omitted data. How can you tell they're lying? It's by how they display their data. And here's the deal. Tooth decay was going up long before they stopped fluoridation. See the blue line? That's when they stopped fluoridation. So she went way back and picked up this data so she could show this increase. But oh, what's that? Isn't that kind of a leveling off? I think there may be evidence that fluoride causes tooth decay. Is this the first time that we've been lied to by industry? It's the first time that my profession has systematically lied to every citizen on the planet, except for the Mercury company. Did we have another time that we lied to people? Well, maybe when we were saying that the little Dutch boy's lead paint was perfectly safe and children could suck on toys made out of it, right? Or when we were chasing mosquitoes a few years ago, and they're demonstrating how you can fog the lunchroom of the school, and it didn't harm a single child because not one of them fell over. Who made that video? That's United States Public Health Service. Would you let your child sit in a fog of DDT? I don't think so. I think the world has changed, but the liars still are employed. And what can you do? You need to have the courage to do the right thing. Because if you don't, it will haunt you for the rest of your life, and you will wonder why you lost your country. Because if you allow industry to poison this generation of children, shame on you. That you don't get to wear the little American flag lapel button. You don't get to call yourself a patriot because you're being a jerk. Stand up and make a big noise about this, because that's the only way we're going to stop it. There are a lot more of us than there are in industry, but it's our obligation, because you're the learned professional, you're the one that's trained, and you need to stand up. Tell the truth all the time. Stand up for ethics. It's not appropriate to put substances in the water that harm people with no kidneys or babies. Use the scientific method to make decisions about your future in dentistry. Demand answers. Get postcards, bumper stickers, letters, videos, and do everything you can to make sure that everyone you come in contact with knows that you're an ethical dentist, and you believe in science, and you believe in protecting the children first, and your reputation goes with that. Because they're relying upon the liar's reputation, and you need to call them what they are. And don't forget, it's slander if I say you're a liar. It's an opinion. If I think you're a liar, in my opinion, can't sue me. Thank you very much.
A quick question for you in regards to the fluorosilicates that are added to the water. I've read Bryson's book as well as Case Against Fluoride. And I'm just wondering, what evidence do we have for the actual, I guess, chemicals that are being added to the water? Where does that data come from?
None. The only data we have is epidemiological. During the congressional investigation of 2000, that in order to have your water additive, that the EPA gave up all control of the water additive in 1986. It's a memorandum of understanding, and that they gave it up under the Reagan administration to industry. And so industry, all the people that generated silica fluoride, formed a panel, and they decided that they would hire American National Standards Institute, ANSI, to develop a standard. And it's the easiest standard in the world to comply with. All you got to do is take a cup of this stuff once a year and have it analyzed, and then furnish the toxicological data on that, and then boom, you're good to go. And so during the congressional investigation, they asked for those analyses, and they didn't have them. So they haven't even done step one of analyzing those. And so they also asked them for the toxicological data on hydrofluorosilicic acid, chronic toxicological data. They've got short-term chronic data showing it kills the animals and that sort of stuff. But they wanted to know what happened if you fed an animal low levels for a long period of time, maybe a year. And they didn't have that data in 2000. They do have it now, and it causes, dental fluorosis, neurologic impairment, and that sort of stuff. We sent that as notice to all the manufacturers so that they can never say they didn't have it, but it doesn't keep them from selling the stuff. So it has not complied with the very first and the easiest standard for water additives that's ever developed, ANSI Standard 60. So that when you say, what data do we have on it? We don't have any. And that what we do know is that if we take the congressional investigation, you can find the data on keepersofthewell.org. There were about 16 studies, not studies, but chemical analysis, and all of them were contaminated with arsenic. Arsenic, lead, and cadmium were the principal things that they were contaminated with. And what the dentists like to say is, well, once I get through dumping this junk in the water, and stirring it around with about 180,000 gallons of good water, then we can't detect it because our standard for detection is so high that we can't detect these low levels anymore. And what a logical person would do is they'd say, well, what we need to do is to analyze the product and then divide by 180,000, and then we could come up with a number of how much is in the water. And when you do that, you have enough arsenic, according to the California EPA, to produce an additional cancer of bladder or lung per 15,000 people. Remember, water is supposed to be not causing any problem per 1 in a million. So we're, with the water additive, the arsenic alone, and I'm not even talking about the fluoride, the arsenic alone is sufficient to cause a whole lot of new cancers of bladder and lung. Anybody ever know anybody got bladder cancer and die of it? It's a very vigorous cancer. Lung cancer, you don't usually survive lung cancer, especially if you do the chemo and radiation. So we are causing mayhem in the health of people in order to help Cargill and other manufacturers of silicon fluoride dispose of their hazardous waste. So unfortunately, we don't have the data that should have been developed in 1986.
Anybody else up here, right?
What is your recommendation, doctor, for the toothpaste for everyday use for the patients, kids, adults?
Well, one of the funny things about toothpaste is that if you were paying attention this week, that they've taken, the FDA has removed triclosan from the soaps and the stuff, but they haven't removed it from Colgate Total and some other things. And why did they take it out of the soaps? Because it is a carcinogen. And so I don't recommend that my patients brush with carcinogens. So for reasons that are not entirely clear, that in saliva are all the minerals and proteins that your teeth need to be healthy. I don't know what God was thinking. She must have had a bad day or something to put all those things in there, because that's exactly what teeth need. So brushing with saliva is a very good thing, rather than sodium lauryl sulfate. If you look at most of those foaming toothpaste, it's sodium lauryl sulfate. Go to the literature, and that increases the number of herpes lesions that you get and aphthostomatitis. So our recommendations of having people use sodium lauryl sulfate, triclosan, and fluoride cause ill oral health. Fluoride is very damaging to bone, so we got 60% of the nation losing their teeth because of bone loss. Is that because they're also using a fluoridated toothpaste? I don't know, but I know that saliva is harmless, so you've always got saliva. You want to have some mint, you can get some peppermint, it's not a carcinogen. Or if you want to use something that neutralizes the acid in your mouth, you can use baking soda. Oh, it's too gritty. I've had dentists tell patients that the baking soda was so gritty it would rip the enamel off your teeth, that the calcium carbonate is the principal grit that you'd find in toothpaste. The molecule of calcium carbonate is actually more likely to rip the enamel off the teeth than baking soda, and neither one of them do a very good job of it. So it's just people make stuff up. So you can brush your teeth with whatever you feel like, and if you put several toothbrushes in your car, then when you get to these octagonal signs here, you can pull up and go to work on them. And especially if you're in San Diego and you have the stop and go traffic, you guys got plenty of time to work on those teeth. So if they have a specific problem like tooth decay, there's a study by Lopez showing that babies that were going to bed with a bottle of what the Puerto Ricans call sweet milk, which is a tablespoon of sugar in the milk at bedtime, they can rot their little teeth right out of their head before you can say Jack Robinson. And so she had these babies come in, and that the nurse dabbed their teeth once every 2 months. So in 6 times in a 12-month period, they dabbed the teeth with iodine. And she wasn't using the good kind. She was using the kind you can get on bandages called povidone. And they dropped the expected tooth decay rate almost 50%. So if you have a child that has a tooth decay problem, you should treat it the same way that you treat periodontal disease or an infected toe. You measure the bug and institute disinfecting procedures with whatever you want to use, iodine, salt water, whatever you want to use, something that kills bugs, and then measure the bug again. When strep mutans is down to a very low level, those teeth will not rot. You can use ozone, you can use a whole host of things kill strep mutans. Strep mutans can't even stand salt. Remember when you got a sore throat, your mother had you start gargling with salt water? That's because the strep bacteria can't take salt. Well, you can brush your teeth with salt then. Oh, it's so gritty. Get popcorn salt because it's already ground up, or you can grind it up with a mortar and pestle yourself. And so lots of things can be used to clean teeth. I just like things that if you can't go to your kitchen and find it, don't use it, because you will find things that are edible that do a fine job of cleaning teeth, and that's what I recommend.
David, could you comment on the recent application towards the use of silver diamond fluoride?
Mm-hmm. Well, if one doesn't work, let's make it worse. What do you think? Silver will kill stuff. So I think it's crazy. My grandfather used to fight tooth decay with silver nitrate, and that worked. You could open up some of these teeth that had been dabbed with silver nitrate, 30 years before, and then they put copper cement over the top of it. And, every old dentist has dug into some of these things and found there's dust underneath because, it's so darn toxic the germs die. So, yeah, that works. But, you can use biological substances like ozone. You can if you got somebody with tooth decay, you can make a little tent over the tooth and blast it with ozone and kill the germs that are causing tooth decay and keep the vitality of the tooth. How many of those teeth died because of the silver diamine fluoride? Well, they don't track that, do they? So I don't recommend anything as toxic. I'm being funny about that, but I really don't. And so that's the good news is that there are non-toxic things we can accomplish. Everything that fluoride promised to be, but isn't. And so we can accomplish all that with things that really are non-toxic and are safe to use.
Any other questions?